Okay.
Huh?
Hi, what?
Hi.
It's been a long time since I met you.
Yeah, it's really long time.
This is kind of hard here. Let's find somewhere else to talk. Let's go. Enough with that one. There's something wrong with your hair, what?
You can see it too. Well, I have lost a lot of hair before. I have tried a lot of ways to overcome this problem. Do you know any other solution for this?
Solution? Do you know about Finasteride and Dustasteride?
Never heard of it before.
Hi everyone! Today, our group will be sharing about two medications, which is Finasteride and Dustasteride. These drugs are commonly used to help to reduce hair loss and improve hair growth, especially in men. Let's take a closer look at how they work and how they should be used.
So, let us know what are finasteride and dustasteride. Finasteride and dustasteride are anti-androgen drugs that are used to counteract the effects of male hormone or androgens by inhibiting androgen synthesis.
So let us see what are the classification of finasteride and dustasteride. Finasteride and dustasteride both works as 5-alpha reductase inhibitors, but finasteride only focusing on type 2, meanwhile for dustasteride focusing on type 1 and type 2. So now, let us see the mechanism of action of each drug. First, finasteride. Finasteride is selectively inhibits type 2 5-alpha reductase, which is an enzyme that converts testosterone to dihydrotestosterone (DHT), which is a hormone involved in prostate growth and hair loss, where finasteride will bind to the active site of the enzyme and block testosterone from binding, and this will reduce the conversion of testosterone into DHT, especially in the prostate and hair follicles. So the result, it will decrease DHT levels by 60 to 70%, and also leads to shrinking of the prostate, and also slows or reverses hair loss for androgenetic alopecia. For the mechanism of action of dustasteride will inhibit both type 1 and type 2 5-alpha reductase, leading to a more complete suppression of DHT production compared to finasteride. Dustasteride is a more potent and broader in effect than finasteride, so the drugs will form a stable anti-drug complex that inhibits the enzyme more completely. So the result, it will decrease DHT levels by over 90% and has a more pronounced effect on reducing prostate size and possibly on hair growth.
Finasteride and dustasteride are medications commonly used to treat conditions that are related to hormonal changes in the body, especially involving the hormone called dihydrotestosterone. There are few conditions where these two drugs are mainly prescribed for. Examples for finasteride are alopecia, benign prostatic hyperplasia, and polycystic ovarian syndrome. Meanwhile, dustasteride are more focused on benign prostatic hyperplasia. Alopecia refers to hair loss, and there are two common types, alopecia areata and androgenic alopecia. Alopecia areata is an autoimmune disease that causes sudden patchy hair loss, usually on the scalp. Androgenic alopecia, also known as pattern hair loss, is a hormone-related condition that causes gradual pattern hair thinning. The onset can be abrupt or slow, and early treatment is important before the hair follicles become permanently damaged. Doctors use the SALT score, Severity of Alopecia tool, to measure how much hair loss on the scalp. Early intervention gives better results, especially when hair follicles are not fully miniaturized yet. Benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate. It is a histopathological condition marked by the proliferation of epithelial cells and smooth muscle, especially in the transition zone of the prostate. Common signs and symptoms include dribbling at the end of urination, nocturia or frequent urination at night, pain after ejaculation, weak or interrupted urine stream, trouble starting to urinate, urgency and frequent urination, in some cases, urinary retention. The main goals of BPH treatment are to relieve urinary symptoms, prevent complications, delay disease progression, and most importantly, improve the patient's quality of life. Polycystic ovarian syndrome, or PCOS, is a hormonal disorder where multiple underdeveloped follicles accumulate in the ovaries due to anovulation or lack of ovulation. It is categorized by menstrual irregularities and signs of hyperandrogenism such as acne, excessive hair growth, or high androgen levels in blood tests. PCOS mainly results from abnormal steroid hormone production, often linked to insulin resistance and high insulin levels in the body. The treatment goals for PCOS include reducing the risk of type 2 diabetes and heart disease, managing metabolic issues and weight, treating signs of high androgen, preventing endometrial hyperplasia or cancer, helping with ovulation for those wanting pregnancy, and providing contraception for those who don't. Now that we have understood the mechanism of action of finasteride and dutasteride, let's move on to their pharmacokinetics, how these drugs behave inside the body. Pharmacokinetics includes four main processes: absorption, distribution, metabolism, and excretion. Both finasteride and dutasteride are administered orally, but they differ significantly in how they are processed in the body. For example, dutasteride has a much longer half-life than finasteride, meaning it stays in the system much longer. Understanding these differences helps us determine the appropriate dosing and anticipate how long the drug's effect will last. Let's take a closer look at each pharmacokinetic parameter and how it applies to both drugs. Let's take a look at the pharmacokinetics of finasteride. First is absorption. Finasteride has a bioavailability of approximately 63 to 80%. This means that a significant portion of the oral dose enters the bloodstream. It reaches its peak plasma concentration within 1 to 2 hours after ingestion. Next is distribution. Finasteride is able to cross the blood-brain barrier and has also been detected in small amounts of the seminal fluid. Its volume of distribution is about 76 liters and it has a high plasma protein binding of around 90%, which helps prolong its activity in the body. Then comes metabolism. The drug is extensively metabolized in the liver by the enzyme CYP3A4. It is converted into two active metabolites which continue to contribute to its therapeutic effect. Finally is excretion. Finasteride is eliminated mainly through feces, accounting for about 57% of the dose. Another 39% is excreted through the urine, mostly in the form of metabolites. Its elimination half-life is approximately 5 to 6 hours, which meaning the concentration of the drug in the body reduced by half in that time. Next, let's look at the pharmacokinetics of dutasteride. For absorption, dutasteride is taken orally and absorbed from the gastrointestinal tract. It has a bioavailability of approximately 60%, and the peak plasma concentration is reached within 1 to 3 hours after ingestion. In terms of distribution, dutasteride has a large volume of distribution ranging from 300 to 500 liters, indicating extensive distribution throughout body tissues. It also has a very high plasma protein binding rate, for about 99% bind to albumin. When it comes to metabolism, dutasteride is extensively metabolized mainly by the liver enzyme CYP3A4 and CYP3A5. It is converted into 6-hydroxydutasteride, which has similar activity to the parent drug. Lastly, for excretion, dutasteride is primarily eliminated through the feces, about 40% as metabolites and 5% as unchanged drug. Less than 1% is excreted in the urine. Its elimination half-life is quite long, approximately 3 to 5 weeks, meaning it stays in the body for an extended period.
So now that we've understood the pharmacokinetics of both drugs, I'll be moving on to an equally important aspect, which is patient counseling. Patient counseling is important to ensure that medication like finasteride and dutasteride are taken correctly and safely, while also helping patients understand possible side effects and how to manage them. Now, I will explain the counseling points related to dosage and administration for both drugs. Finasteride is used for male pattern hair loss at a dose of 1 mg once daily and for BPH at 5 mg once daily. Dutasteride, on the other hand, is only used for BPH at a dose of 0.5 mg daily. Both medications should be taken at the same time every day, with or without food. Finasteride comes in tablet form and it must be swallowed whole. Dutasteride is in capsule form and it must not be opened or chewed because the contents can irritate the mouth or throat. PSA levels need to be monitored regularly during treatment with both drugs. Pregnant women should not handle broken finasteride tablets because of the risk of absorption through the skin. And also, dutasteride stays in the body for up to 6 months even after stopping treatment, so follow-up is important. Now, I'll talk about how long the treatment usually takes and its potential side effects. Finasteride show effect for hair loss after at least 3 months, and for BPH, it can take 6 to 12 months. Dutasteride, on the other hand, require longer treatment up to 4 years for maximum benefits in BPH. Both drugs are long-term therapies and need to be taken continuously to maintain their effects. Therapeutically, they help reduce prostate size and improve urinary symptoms. For hair loss, both slow down shedding and promote regrowth, but dutasteride tends to be more effective because it blocks DHT more strongly. Common side effects for both include sexual dysfunction, reduced sperm quality, and sometimes waist changes or mood effects. Some of this may continue after stopping the drug, especially gynecomastia. Monitoring is important throughout therapy.
So, after going through the counseling point, let's see what precaution and warning we need to keep in mind when using finasteride and dutasteride. finasteride and dustasteride must not be used by pregnant women or women who are planning to become pregnant. This is because the medicine can harm the development of a male baby, especially causing birth defect. Pregnant women should also avoid touching broken tablet or leaking capsule, as the drug can be absorbed through the skin and still cause danger to the fetus. These medications are not recommended for women or children in general. They are specifically made for male condition, and using them in other group can be unsafe or not effective. Patients who have liver problem need to be extra careful when using this medicine. This is because both finasteride and dustasteride are processed in the liver. If the liver is not working well, the drug might build up in the body and cause unwanted side effects. Another important point is the medication lower PSA level in the blood. PSA stands for prostate-specific antigen, and it is a marker used to screen for prostate cancer. So, this drug might make it harder for doctors to detect early signs of prostate cancer because the PSA result may appear lower than it really is. That's why it's important for patients to inform their doctor if they are taking this medication before doing a PSA test. Now, let's talk about drug interaction, specifically when one medicine affects the way another medicine works. This is what we call a drug-drug interaction. For finasteride, certain other medicine can affect how it works. For example, if a patient takes ketosanazole, which is a strong enzyme inhibitor, it can increase the level of finasteride in the body. This might increase the chance of side effects. On the other hand, if the patient is taking rifampin, which speed up how the liver processes medicine, finasteride may be cleared from the body too quickly and become less effective. Dustasteride also has similar interaction, but it is even more sensitive to this effect. Medicine like ketosanazole, erythromycin, and verapamil can increase the amount of dustasteride in the blood, which may lead to stronger side effects. Meanwhile, drugs like rifampin can reduce its effectiveness by lowering its level in the body. Next, for drug-food interaction, the good news in the both finasteride and dustasteride do not have major food interaction. They can be taken with or with the food. However, for the dustasteride, it's the best to take it consistently at the same time every day to maintain a steady level in the body. Okay, now let's look at the storage and handling interaction for finasteride and dustasteride. Finasteride tablet should be stored at room temperature around 25 degrees Celsius and must be kept away from moisture and heat. They should also be stored safely away from children. If the tablets are crushed or broken, pregnant women must avoid touching them. It is also important not to use the medicine after the expired date. The sterile capsule need to be stored in a cool, dry place and protected from heat and light because the capsules are soft gel. They may leak if damaged. Therefore, they should be handled carefully, especially by pregnant women who must avoid touching any broken or leaking capsule. Like finasteride, dustasteride should be kept out of reach of children and not used past its expired date. I think that's all from us. Thank you.
Oh, itu aku.
Itu baik tak jatuh.